Well, welcome everyone. I am Katrina Miller. I am the infant and early childhood mental health specialist with DELC, the Department of Early Learning and Care. I am part of the Professional Learning System Office with John Reeves. And let's just do a couple quick introductions. So I'm going to toss it to you, John, to introduce yourself.
Excellent. Thanks, Katrina, and welcome everyone. My name is John Reeves. I'm the Professional Learning System Director at the Department of Early Learning and Care. And among many things that come through my department, the Early Childhood Suspension and Expulsion Prevention Program is one of our primary aspects of work, and building our system of regional service providers, which is what this webinar relates to, is a key activity. So I'm looking forward to being with you all today. And I'll kick it over to Laura.
Hi, everyone. I'm Laura Spray. I am a senior contract specialist with DELC from the procurement department. So I am working with Katrina and John on this with the application piece and the procurement part. So any questions pertaining to the RFA will be directed to me. And I saw Allison, but I don't know if she wants to hop on and say hi.
She may have stepped away.
Katrina.
Yeah. Well, I was just going to say, there's such a small number of us. I'm wondering if the rest of you would be willing to introduce yourselves too. Let's see. How about Athena? Would you be willing to introduce yourself, if you would prefer not to? We're not gonna force you.
I'm Athena Wickstrom. I'm the Early Learning Program Facilitator for the South Central Early Learning Hub. So we cover Douglas, Klamath, and Lake counties, the Klamath tribes, and the Cow Creek Band, the Bumpco tribe of Indians.
Thank you. Who wants to go next?
I'm Jillian Wiesenberg. I'm the director of the South Central Early Learning Hub, which includes all of the areas that Athena mentioned. And our chair, Steve Shennework, if he'd like to introduce himself, of our Governance Council.
Sure, I'm Steve Shennework. I have a full-time job as pastor at Community Baptist Church in Winston. It seems like most weeks I spend more time volunteering in a variety of other capacities, than doing my real job. But I am the chair of the regional governance team for the South Central Oregon Learning, South Central Early Learning Hub, which covers, as Athena said. I'm not going to repeat all that.
That's great. Thank you.
Hi, everyone. I'm Charlotte Carver from the South Coast Regional Early Learning Hub, covering Coos, Curry, Coastal Douglas counties.
Hi, I'm Skydra Schooley. I'm also with the South Coast Regional Early Learning Hub.
Well, welcome everyone. We are recording this, so anybody who was hoping to be here but couldn't will be able to watch this after. So I am going to share my screen, pull up some slides, and let me just do that. What we will do is, let's see, am I sharing the correct screen? Do you see? Yeah, okay. I suddenly was worried that you could see all of my messiness over here. But what we'll do is we'll talk a little bit, kind of a high-level overview of the Early Childhood Suspension and Expulsion Prevention Program and its kind of multiple components, and then we'll dive deeper into what is this request for applications actually all about. So there we go. Oh, I just talked about that. In terms of procurement information, Laura said this when she introduced herself, but she's the single point of contact. Her email, her phone number is on here. And yeah, reach out to Laura with any questions that she has, and we'll communicate and get answers back to you. So a little bit of background is this work actually started, or the precursors of this work started back in 2019 and 2020. There was a steering committee that was working on bringing infant and early childhood mental health consultation to the state. There's also the Governor's Racial Justice Council that was looking at how do we actually tangibly and meaningfully make progress in racial equity across the state. There was also community advocacy efforts from local organizations pointing to the need for let's work on preventing suspension and expulsion. It's, as we know, suspension and expulsion disproportionately impacts children with disabilities and children of color, particularly Black boys, more than other groups. And so all of these things kind of coming together. There was legislation passed, which I think is on my next slide. But we also, well, it was the Early Learning Division at that point, commissioned a report from Portland State University on design recommendations for a statewide model of infant and early childhood mental health consultation. And so then that was published in, I think it was January 2022. And it is a really useful report that has been really helpful for us in designing the mental health consultation elements of the suspension and expulsion prevention program. Let's see there. So the legislation that was passed, and this was passed in 2021, Senate Bill 236 is one that a lot of people know about because it establishes a ban on the use of suspension and expulsion starting in July of 2026. And it's really quite a comprehensive ban. It will apply to the vast majority of early learning programs that are certified or registered or that receive public funding. And it also calls for a study on the use of suspension and expulsion, which is it's due this fall and is currently underway. We have partners at the Coalition of Communities of Color who are leading that research study. And many of you will probably hear about some interviews and focus groups that are coming up over the summer months. One more thing to say about Senate Bill 236 is that this bill really came from, it was driven by community advocacy groups and community partners who identified loud and clear, we need to do something as a state to address suspension and expulsion. So it's really that kind of, yeah, from the ground up, if you will, initiative. House Bill 2166 is another bill that was passed at the same time, and it establishes formally the Early Childhood Suspension and Expulsion Prevention Program. And there's a whole long list of things in the legislation that DELC is asked to do in partnership with other organizations and other state agencies. But it also includes an array of different types of services for early learning programs for the community. We'll talk a little bit more about that on the coming slides. So the purpose of the program, this second bullet point, actually comes pretty directly from the legislation. The purpose of the program is to reduce the use of suspension and expulsion and to eliminate disparities in the use of suspension and expulsion. When we think about reducing suspension and expulsion, what is the opposite of exclusionary practices? Well, the opposite is inclusion. So we've added this first bullet point to really identify that, where a part of our purpose is to promote inclusive values and policies and practices. Many of you have probably seen this before. This is a graphic that we use to describe the or to depict how we think about the program as a whole and our approach to preventing suspension and expulsion. So the regional service providers that we're talking about today fall into this yellow quadrant where it says infant and early childhood mental health consultation. They also connect with this orangey red quadrant called the coordinated system of support. And so we're doing a lot of system building around these two components. The top components are really thinking about, we already have a significant professional learning system in Oregon, and there are opportunities to look at what additional things could we do, or how do we balance things out and add things where we need to point towards making sure that everything is working to prevent suspension and expulsion. So all together, you'll notice this blue line around the outside. It says program approach. This is really like the whole program is made up of all of these components. So training for early educators, and at some point I need to change this word from training to more like professional development or professional learning, because it's more than just sitting in a training. It is about that professional learning, professional development, the skill development that it takes to make sure that we're offering high quality early childhood education. Training and technical assistance. We have a great technical assistance workforce. It's continuing to support that workforce and expand offerings such as pyramid model supports that we know go towards preventing suspension and expulsion. Then the infant and early childhood mental health consultation. We'll talk a lot more about this, but mental health consultation is a prevention-based approach. It's focused on building the capacity, the skills and abilities of the adults who work with the children, not about diagnosing children or providing mental health treatment. And then the coordinated system of support is kind of the piece that ties all of these together. How do we ensure that our mental health consultants, our new kind of workforce of mental health consultants, is coordinating and collaborating with our coaches and our quality improvement specialists and the early childhood special education providers in the community? It's thinking about how do we coordinate and align all of our different pieces together. It also includes, we're working towards building a warm line, which by a warm line, we mean an access point. Initially, it will be an online access point for educators to say, I need some support, or I need some help. They may identify a specific child as needing support, or they may say, this group of kids is putting me through my paces. I am having a run for it this year, and I need some more support. But having an access point that will help to make technical assistance or mental health consultation easily accessible. Any questions about any of that so far? I went over some of that fairly quickly.
I have a question.
Yeah.
Could you give a quick summary of who is responsible for or doing each of these quadrants? Like, there's the regional service providers that are doing the bottom yellow. Is the central entity doing the red? Like, can you just...
Yeah, good question. So I'm going to start at the top. All of these components related to training, technical assistance we're going to think about our CCR&Rs, our then like TRI and LC, who are helping to build kind of the build or support the technical assistance infrastructure. there's going to be OCCD, Oregon. Oh boy, Oregon. Uh,
I can
yeah,
support.
you can help me out,
You
John.
threw out a few acronyms. So
I
TRI
did.
is the Research Institute. They support childcare resource and referrals as essentially the central entity, but they help prepare CCRNRs to do high quality work. They're at Western Oregon University. Katrina mentioned ELSI, which is the Early Learning System Initiative. They work with our coaches in our public funded programs, but are also creating some additional supports in the system that might be training or professional development on certain subject matter. They have some wonderful training opportunities called Roots to Resilience, which kind of live in that space of social emotional supports and anti-bias practices, and so they're at the Oregon State University. And then Katrina was just talking about the Oregon Center for Career Development, which is our Oregon registry system, where it's helping our early educators have access to essentially be able to evidence their qualifications for the positions that they're in, but also that's the place where a majority of the trainings get logged in our system throughout the state. So if there's any professional development opportunities for early educators, most of those get inserted there. And so I'll pass it back over to you, Katrina, to get back to the thought you were.
Yeah. Thank you, John. Thanks for bailing me out. I appreciate it. There's a lot of alphabet soup sometimes.
There's so many acronyms.
So the regional service providers are the ones providing the infant and early childhood mental health consultation. The central entity will also support this because they'll be bringing sort of content expertise. There's a few areas in Oregon that have had access to mental health consultation and have some local expertise, but generally speaking, across the board, there's not a wealth of knowledge on mental health consultation. So our central entity, I was going to use another acronym, the Oregon Infant Mental Health Association, or ORIMHA for short, will be bringing in that expertise. They, in terms of this coordinated system of support, ORIMHA is going to be helping with parts of that. DELC is leading parts of that. And pretty much, well, regional service providers will definitely have a role with that. I think when I think about a coordinated system, I think about all of the partners having a role is as part of the coordinated system. It doesn't belong to any one entity, but DELC and ORIMHA will do some kind of facilitation or provide support where necessary to help create that, but not own it. Does that help?
And I think in that coordinated system, it'll be where DELC and ORIMHA will be doing some work would be to pull partners together through, including our early learning hubs and our childcare resource and referral programs, and continue to think about what other partners need to be at your local tables as you're thinking about how you coordinate and respond to needs as they arise. And so there will be some really tangible opportunities to think out loud about how do we do that to bring partners together and think about each organization's role and function in this. But that's where we imagine early learning hubs will be, not only how some of you are coming to the space around helping your communities think about who the regional service provider might be. There's opportunities to think about how partners will show up together and work on these complex the complex needs that come up in your communities.
I have a question. In a county like Lake, who has scarcity and may not be able to come up with people at the table, or very few who are overwhelmed already. So will RMHA be the ones to incorporate something, or will they add to the table? And I don't know, I'll let Dina Hagenschild, our governance council member from Klamath, is on. I'll let her speak for Klamath, but I'm just curious, when there's scarcity and it's frontier, you know, what are the plans?
Welcome, Dina. And Jillian, I think that's a great question. And I know your region is the largest in terms of like actual square miles, and a lot of distance in between places. I would say that those are things that we kind of need to explore and answer together. Like RIMHA will help in the sense of they want to hear exactly that, and we want to hear exactly that, and then think together about what are the resources that may be needed. What are the specific circumstances that we need to navigate around? So we're trying to come in as um, not as having all the answers, because we don't, but to create a space where we can hear from you and work together to come up with the solutions if possible.
And I guess to add to that, so what are the expectations? I'm just talking about my, apprehensions. What are the expectations, if everyone comes to the table and there's still scarcity? What are the thoughts? What are, going forward?
Yeah, good question. And not easy answers. Like we're hearing the questions around scarcity from across the board. And I see John has come off of mute, so I'm going to let him answer.
And Jillian, I think these are important considerations, and kind of why we're putting this request for application out there is we know that each region has some unique resources, but also unique challenges. And part of this is not to say you've got your regional service provider all figured out and they're going to solve all the all the woes with the partners that are already installed in communities. Part of this is to do some of the planning around that. So the question you're asking is one of the questions that's going to be on the table with this planning grant. How will you use the resources to identify those questions? And of course, RIMHA will be one of the primary partners to help think about, what can we replicate that's working elsewhere, but also where are there going to be really significant gaps, and then what would be the recommendations that we would have, because we're going to be able to start doing some of this work even after the planning stage, which is related to this request for application. But there's always going to be a need to do something more, because we're not going to solve all the things with the resources that are allocated within the legislation that are wonderful additions to what we have now for our state, but there's still going to be gaps. But I think that planning stage is going to be our opportunity to really identify what exists, how will partners show up in these areas to address the needs, and where there's still big holes. And
so there's hope that, that it may still be scarce and someone somewhere will, kind of help. And, that's the hope, right?
Yeah, we're going to have to get creative, because, if a region, because there's going to be times too when a region, even once this is launched and is up and running, staff turnover, right? We know this in various ways. And so how are we going to fill the gaps when we have key members and communities that were supposed to be there to respond and there's nobody to respond? So we have to answer those questions too. But I really appreciate you bringing it up. That's part of what we hope the planning will help us to develop strategies for. But it's going to be, you know, we're building a statewide system, and there's very regionally specific things that we are going to need to take into account too.
So we really are a we, and so it can't be any one entity of any of the circles. It's we are in it together because not one can solve the issue. And I also wanted to introduce Sean Massengale, who's UCAN Head Start in Douglas County. So anyway, Douglas and Klamath and Lake are pretty well represented. Steve is our chair and kind of represents them all. So anyway.
Excellent turnout. I'm glad you're here. Any other questions before I go into more around the regional service providers? Okay. So the regional service providers, the biggest piece of the work is around infant and early childhood mental health consultation. It also ties into that coordinated system of support, but the particular kind of like specialization of the regional service providers is the mental health consultation. So this slide has a lot of words on it. I'll talk through it. We wanted to kind of, and John already touched on some of this, or at least sort of, during the planning grant process. So this is a request for applications to engage in a planning process. And during this planning process, if assuming that your organization is awarded the planning grant, you have kind of three big buckets of options by the end of the planning grant period. If you are the successful applicant, if you're awarded the grant, you can then identify yourself as the organization that will become that long-term regional service provider and be the one that implements mental health consultation. There could be a situation in which during this planning period, you identify that you are not the best organization to be the long-term regional service provider, and that somebody else in your region is. And so at the time of, and that's part of why this is a planning grant, is to allow that space to do that exploration, to identify who that is. So at the time of a transition to an implementation grant, so at the end of the planning period, you can then opt to subcontract or sub-award to whoever that other entity is, or it looks like that we'll be able to transition the grant to the other entity if that's what's desired, without having to do another procurement process. The third option is it's possible to identify a different entity that is not located in the region if community engagement activities show that community would accept this as a good solution, and if this other entity is able to meet the criteria basically and complete the statement of work. In this case, we would want an organization in the region to continue to be the grant holder. So for example, Jillian, let's say that in this process, you say, we aren't going to be the regional service provider, but organization X is, but they're just outside of your region. We would want you to kind of still to have that regional ownership of the work of the regional service provider. So we'd want the grant holder to be in the region. But if there's a situation where you need an entity that's outside the region, if your community is okay with that, ultimately we're okay with that. Does that make sense?
So the assumption is that if you're applying for this grant, you're not just applying for a planning grant, you're applying for the planning and implementation. Because I think in the past it was either or, and so just wanted clarity on that.
Yeah, good question. It was in the past, you could apply for planning or implementation. But even if you applied for planning, then it would lead into implementation. And as it currently stands, all of the organizations that currently have planning grants, let me say it a different way. All of the organizations that applied in the first round received planning grants and not implementation grants. Let's see, was there another element to your question? Yeah.
So I have another question with that. So, our region is very large. It takes about 8 hours to drive from one end of it to the other.
A lot.
And longer if there's snow or traffic or cattle in the road. And so with that, does the subcontractor, can there only be one subcontractor providing the behavioral health services, or would it be potentially beneficial to have separate ones to cover the region based on how large it is? Is that possible? What does that look like?
That's a good question. And my inclination is to say that's the thing to be discovered during the planning process. I will say it can be challenging to find, like, thinking about dividing it into two separate like subawards. It can be challenging to hire a part-time position or two part-time positions rather than one full-time position, but there's situations where that might be the right scenario. So I think that's a good question, and let's see what you discover. Okay, so the other thing that needs to happen during the planning grant, this is in the RFA materials. I didn't list quite everything on this slide, but some of the bigger bullet points is doing some community engagement, really looking at those community partnerships, collaborative partnerships related to that coordinated system of support, participating in a community of practice related to developing the statewide model of mental health consultation. And we're looking at something we're calling a workforce equity plan, which is just a way of kind of formally saying, let's think about our recruitment and retention strategies in the short term and the long term, and how do we diversify our mental health consultation workforce. Yeah. So as the planning grant, if you're the planning grant grantee, then we would want either you to complete all of these activities, or if you are identifying a different organization who will be that long-term regional service provider, that then they are completing these activities. So one way or the other, by the time of transitioning to implementation, we would want sort of whichever organization it is to be ready to move into implementing mental health consultation. Does that make sense? Questions about that?
So the timeline for these planning grants is, would it start July 1st of this year and run for, it's up to 12 months?
It's up to 12 months. It may take us, hopefully we can get it all done by July 1st. And get you like grant agreements done by July 1st. That may be a little bit, well, it probably is a little bit optimistic since this closes on June 21st. But it would be from whatever point that starts, would be 12 months from the time that the agreement is signed.
Thank you. One more question. For the first cohort of people who have applied for planning grants, are they moving into an implementation grant this year, or are they also planning and then moving to implementation next year?
They will, within, so everybody's in planning right now. As they get ready, they'll be able to transition into implementation. But we anticipate that that's still a work in progress. Nobody's like right there just yet. It will probably happen at a different pace for different groups. We're sort of thinking about cohorts of who is entering, that is like going to be first out the door, and who is next and who's next, and not in any preferential way, but just recognizing there's differences in readiness to jump into it. Does that help?
Yeah, I'm curious if we were all going to be moving into implementation at the same time, or if there's others that would be starting before.
There are likely to be others that are starting before those of you who are here today, because they have a head start, and because some of them have some experience with mental health consultation around the edges. So yeah, it will probably be a staggered in several different groups. I think I'm going to actually skip this and talk about it here. So the central entity, their role is really to provide kind of centralized infrastructure and support for regional service providers throughout the planning process and throughout the implementation process. So all of the aspects of implementing mental health consultation. They'll provide content expertise, and they'll facilitate communities of practice, other kind of training opportunities, both for program leaders and then eventually for consultants, once consultants are hired. And there's just a lot of collaboration that they're going to be doing, and to some extent, it's joining collaborative processes that are already underway, and to some extent, it's facilitating collaborative processes together with other organizations, focused on making sure that we're embedding equity and healthy practices and preventing suspension and expulsion across our system. But they will be a go-to resource for all of the regional service providers. The advantage that you all have is that we now have the central entity on board. And the disadvantage of the people who are currently in planning grants is that we didn't have the central entity identified and on board at the point when they actually received their grants. So components of the work, it's kind of all of these different components around hiring and outreach and service delivery and partnership with others. So knowledge of community and culture. The reason that we're really thinking about these as regional service providers is because we want it to be tied to the region and to your own community and connections. Each of these slides is kind of an element that's reflected in the statement of work. Program infrastructure and staffing. There's a collaboration and teaming with the central entity, eventually hiring mental health consultants, providing that supervision, providing reflective supervision or licensure supervision if it's available locally. But if it's not available locally, then a REMHA is going to be standing by to be able to help provide that, and also to provide training in reflective supervision. We'll want consultants, once consultants are on board, to participate in core training, communities of practice, that kind of ongoing professional development, professional learning support. service delivery, and this some of these specifically came from the Centering Racial Equity report, or were drawn from recommendations in that. This is not like rigid. This is one of these things that we're going to discover, particularly around the length and the frequency of visits. This is something that we're going to discover together about what's feasible. But it'll include child-specific observation, classroom observations, program level observation. So a lot of different kind of working across the system level within programs. Being a partner in the coordinated system of support, kind of just coordinating with technical assistance providers, other organizations, or early intervention and early childhood special education providers, and collaborating with behavioral health. Warm line response teaming, we're calling, instead of using the word triaging, we're using the word teaming. When those requests for support come in, what's the community level process for saying, this request for support sounds like it is perfect for I'm gonna choose infant toddler specialist. Let's say there's an infant toddler specialist who's already connected to the program or who has a shared language with the program. Maybe that's the person who's the best person to respond, or maybe it's the mental health consultant. There could be any number of different kind of connections, but that's part of this coordinated response and this teaming together to decide on the response system. There's data, of course, the data collection process. And some of this will be use of screening tools related to child-specific observation or classroom observation, as well as just, keeping track of the services provided. The sections of the application, it has been significantly simplified and shortened from the first version. So if you reviewed the first version, this has the same themes, but is a lot more compressed. So there's basic information, applicant information, who are you, a section about community connections, section on the coordinated system of support and how you're already connected with your regional system, and equity-centered and trauma-informed organizational policies and procedures. And part of the questions around this are you can think of it in two different ways. One is like, what's your readiness, but also what is the thinking about, this is a process where you may be choosing somebody, a different organization, to be that regional service provider. What is their readiness around these things? And you don't have to know that now. It's just about the commitment or the understanding of what it is that we're looking for in that regional service provider. And important dates. This is, you are here today where the green star is, the pre-application webinar. And then the Friday, June 24th. Oops, I have June 21, 2024, comma 2023. Apparently I forgot to delete the 2023. So that is a Friday. It closes at 5 p.m. And if you get into the application process and it seems like it is longer than you expected and it is going to be impossible to meet June 21st at 5 p.m., please reach out to Laura, and in advance, please, not at 4:59, and we'll see what we can do. We are interested in, if possible, holding to that time, simply so that we can get the grant agreements out and get the process started. And then there's a 7-day protest period from the time that we issue the notice of award or of intent to award, and then we would get your grant agreements in place. And finally, we have a refresh on Laura's contact information. And I'll ask if there are any questions.
I guess I'm just curious what's condensed, because I saw the old one and I saw this one. It looks like there's a lot of similarities, so I'm just curious.
Some of the questions came out, and there are some narrative questions, but there is not as much of a narrative. The section around the equity-centered and trauma-informed organizational policies and procedures there's actually one whole section that was on here. There was an E. There used to be an E on here, and it's no longer here. So it is similar. We tried to get towards the same theme, same information, but to make it less bulky to respond to.
Thank you.
Charlotte.
Hi. I don't remember when I was looking through it, and it might be there, but I don't remember seeing a whole lot of instructions or guidance about the use of funds. Like, there's the scope of work and activities that are expected in the planning grant, but I'm just curious about like what restrictions or flexibility there might be in achieving the scope of work and how we use the funds.
I would say it is fairly flexible. There are our grant specialist is out of the office this week, so she's not here with us. But there are some restrictions around use of gift cards and use of incentives, although it's a little bit more flexible than it used to be. Like, we want to support you in achieving what you want, but really it's pretty, other than some of those kind of like details around reimbursement to other people, it's fairly flexible about how you want to use the planning grant funds. A lot of regional service providers are contracting with somebody to help with either community engagement or other forms of planning related to this. It's one of the things we've heard is we don't have more staff time to put to this. Like, if that's the case, I understand that. And if you want to identify somebody to bring on a contract basis to help with some of that, that's fine. Does that help?
Yes, I'm cute. So I imagine a lot of folks are contracting with somebody or paying for staff time to coordinate the outreach, and maybe there's some supplies and materials for the outreach activities. Is training allowed as well?
Training is allowed. I think I would just want to interface that with what is the training that is already going to be provided by the central entity that like we wouldn't want to double up on it. That's all. But if you submit your budget and we have questions, like in the process, in the grant agreement process, we'll have a chance to kind of talk about coming to agreement on those things. Yeah. Athena.
When the grant specialist is in the office, can we get some more clarification around what is allowable in terms of reimbursements and things like that? As I know that there's a lot of outreach that is requested for this, and if we're engaging parents, we want to make sure that we're able to provide incentives and that we're being respectful and thoughtful of our parents' time and efforts
Yes.
and helping with this. So if we can get some more guidance around that and really around what the allowable or is not allowed in terms of that, that would be really helpful.
Yep, we can do that. So there is a process. Let me go to this one. So I'm noting your question now. There's also this line here where it says questions or requests for clarification. Any questions that you have after today, email Laura, and then Laura will let me know, and we will provide a written response, which will then be posted. It gets posted in Oregon Buys, but we'll post a response so that you can have that information.
And I understand other regions are looking at possibly contracting out the community conversations and creating and designing a behavioral health system. So just, I guess those are possibilities.
We've left it fairly open. It's what are the activities that will help you to meet the criteria in the planning grant, meet the activities in the planning grant, and be ready for implementation of mental health consultation. Well, thank you everyone for joining us today. Really good questions. And like I said a couple minutes ago, do send any questions that you have to Laura, and we will get answers for you.
Thank you very much, and I'm sure we will, and I appreciate your answering our questions today.
Absolutely. My pleasure.
Thank you, everyone.